Did you know that fatty liver disease can develop quietly for years without causing obvious symptoms? Millions of adults are living with excess fat accumulating inside their liver, and many people don't discover it until they have a routine blood test, an ultrasound, or another medical examination. And here's what makes this condition so important to understand. You don't necessarily need to be overweight to have fatty liver. You don't necessarily need to drink alcohol, and you don't have to feel sick for a problem to be developing inside your liver. Today, we're going to talk about fatty liver disease, also commonly called MASLD, or metabolic dysfunction-associated steatotic liver disease. We'll look at some warning signs that shouldn't be ignored, the everyday habits that can increase your risk, the foods that may support better liver health, and the lifestyle changes that have the strongest evidence behind them. We'll also talk about popular remedies such as apple cider vinegar, milk thistle, coffee, intermittent fasting, and certain supplements, and I'll explain what they can and cannot realistically do. So if you're concerned about your liver, stay with me until the end, because we're going to finish with a simple 7-day starting plan that you can use to improve your overall metabolic health. Let's get started. Why fatty liver can be so easy to miss. Your liver is one of the most important organs in your body. It helps process nutrients, stores energy, produces important proteins, helps regulate blood sugar and cholesterol, and processes many substances that enter your bloodstream. But like every organ, it can become affected by long-term metabolic stress. One of the most common problems is excessive fat accumulation in the liver. A small amount of fat in the liver can be normal. The problem develops when fat accumulation becomes excessive and is associated with metabolic problems. This is where insulin resistance, obesity, type 2 diabetes, high triglycerides, high blood pressure, and other metabolic risk factors can become important. And here's the surprising part. Many people with fatty liver don't experience dramatic symptoms. That's why you shouldn't wait for severe pain before paying attention to your liver health. Fatty liver is often discovered through blood tests, imaging, or an evaluation for another health condition. So let's talk about some possible warning signs. Warning sign number 1, unexplained fatigue. Feeling tired from time to time is normal. Maybe you didn't sleep well. Maybe you're working long hours. Maybe you're under stress. But persistent fatigue deserves attention, especially when it's combined with other metabolic risk factors. Some people with fatty liver disease report tiredness or a general feeling of low energy. However, fatigue by itself does not prove that you have fatty liver. There are hundreds of possible causes of fatigue, including poor sleep, anemia, thyroid problems, nutritional deficiencies, medications, stress, depression, and many other medical conditions. So don't automatically blame your liver. Instead, think of persistent fatigue as a reason to look at the bigger picture. How are you sleeping? What are you eating? How active are you? What is your blood pressure? What are your blood sugar and cholesterol levels? And when was the last time you had a routine medical checkup? Sometimes the most useful health information comes from putting all of these pieces together. Warning sign number 2, increasing waist size. Here's another important clue. Your waistline can tell you something about metabolic health. Visceral fat is the type of fat stored around internal organs. It is different from the fat that sits directly underneath the skin. Higher amounts of visceral fat are strongly associated with insulin resistance and metabolic dysfunction, and those same metabolic problems are closely connected with fatty liver. This doesn't mean that everyone with belly fat has liver disease. It also doesn't mean that someone with a normal-looking waistline is automatically protected. But if you're gaining abdominal weight while also experiencing high blood sugar, high triglycerides, high blood pressure, or abnormal cholesterol levels, it's worth discussing your metabolic health with a healthcare professional. The goal shouldn't simply be to look thinner. The goal is to improve the health of your entire metabolic system. Warning sign number 3, dark patches or skin changes. Have you noticed dark, thicker, velvety-looking skin around your neck or armpits? A condition called acanthosis nigricans can sometimes be associated with insulin resistance. Skin tags can also occur more frequently in people with insulin resistance and metabolic problems. But once again, these signs are not a diagnosis of fatty liver. They are clues that may justify a broader health evaluation. If you're noticing these changes, especially alongside weight gain, elevated blood sugar, or a family history of diabetes, talk with your doctor. The important thing is not to panic. The important thing is to investigate. Warning sign number 4, discomfort under the right ribs. The liver sits in the upper right part of your abdomen. Some people with liver conditions may experience discomfort or a feeling of fullness in that area. But abdominal pain has many possible causes. Gallbladder problems, stomach problems, muscle strain, digestive disorders, and other conditions can produce similar sensations. So if you have persistent or severe abdominal pain, don't try to diagnose yourself with fatty liver from a YouTube video. Get evaluated. And if you develop yellowing of the skin or eyes, swelling of your abdomen or legs, vomiting blood, confusion, or other severe symptoms, seek urgent medical attention. Warning sign number 5, abnormal blood tests. This is one of the most important points. You can have fatty liver even if you feel completely normal. Your doctor may notice changes in liver enzymes such as ALT or AST, but normal liver enzymes also do not completely rule out liver disease. That's why healthcare professionals may use additional tests, imaging, or non-invasive scoring systems to estimate the risk of liver fibrosis. If your doctor tells you that your liver enzymes are elevated, don't simply start taking a random liver detox supplement. Find out why they are elevated. There are many possible causes. The right treatment starts with the right diagnosis. What actually causes fatty liver? Now let's get to one of the biggest questions. Why does fat build up inside the liver? There isn't always one single cause. Metabolic dysfunction plays a major role in many cases. When the body becomes less sensitive to insulin, the way it handles glucose and fat can change. Excess calories, obesity, insulin resistance, type 2 diabetes, high triglycerides, and low physical activity can all contribute to the development and progression of fatty liver. And sugar can be part of the problem, but the story is more complicated than simply blaming one ingredient. High intake of sugary drinks and foods that provide large amounts of added sugar can contribute to excess calorie intake and metabolic dysfunction. Fructose is also processed significantly by the liver, but that does not mean that every fruit is damaging your liver. Whole fruit contains fiber, water, vitamins, minerals, and naturally occurring sugars in a food matrix that is very different from a sugary soda. So instead of fearing fruit, focus on reducing added sugars and highly processed foods. The biggest dietary target, sugary drinks. If there's one easy change many people can make, it's reducing sugary beverages. Think about soda, sweetened energy drinks, sweet tea, sugar-loaded coffee drinks, large amounts of fruit juice. These drinks can deliver a surprisingly large amount of sugar and calories without making you feel particularly full. When you're drinking hundreds of calories instead of eating them, it can become much easier to consume more energy than your body needs. A simple first step is to replace sugary drinks with water, sparkling water, or unsweetened beverages. And if you enjoy coffee, you don't necessarily have to give it up. In fact, coffee consumption has been associated in observational research with better liver outcomes. But that doesn't mean coffee is a magic cure. And loading your coffee with large amounts of sugar and high-calorie syrups changes the equation. Remedy number 1, coffee. Let's talk about coffee. Coffee is one of the more interesting foods when it comes to liver health. Research has found associations between regular coffee consumption and lower risks of certain chronic liver outcomes. Some studies suggest that coffee drinkers may have a lower risk of liver fibrosis and cirrhosis. But remember the word association. This does not prove that coffee alone prevents liver disease. Still, if you already tolerate coffee well, unsweetened or minimally sweetened coffee can fit into a healthy diet. For many adults, around 2 to 3 cups per day may be reasonable, depending on caffeine tolerance and individual health circumstances. But if caffeine causes anxiety, insomnia, heart palpitations, or other problems, don't force yourself to drink it. Your overall lifestyle matters much more than one beverage. Remedy number 2, apple cider vinegar. Now let's talk about one of the most popular natural remedies, apple cider vinegar. You've probably seen videos claiming that apple cider vinegar melts liver fat or detoxifies the liver. Be careful with those claims. There is some research suggesting vinegar may modestly influence blood glucose responses or other metabolic markers. But there isn't strong evidence that drinking apple cider vinegar directly reverses fatty liver disease. So don't think of it as a cure. If you enjoy vinegar, using a small amount as part of a salad dressing is reasonable for most people. But drinking concentrated vinegar every morning can irritate your throat and stomach and may damage tooth enamel. Never drink it undiluted. And people with certain medical conditions or medications should ask their healthcare professional before using it regularly. The lesson here is simple. Don't look for a miracle ingredient. Look for sustainable habits. Remedy number 3. Milk thistle. Another popular supplement is milk thistle. Its main active compounds are collectively known as silymarin. Milk thistle has antioxidant properties and has been studied for different liver conditions. But here's where online health content often goes too far. Research has not established milk thistle as a proven cure for fatty liver disease. Some studies have shown changes in liver enzymes, but evidence is not strong enough to say that everyone with fatty liver should take it. Supplements can also interact with medications. So if you're considering milk thistle, especially if you already take prescription medicines, speak with a qualified healthcare professional first, and never use a supplement as a replacement for medical evaluation. Remedy number 4. Cruciferous vegetables. Now let's move towards something with a much stronger nutritional foundation. Vegetables. Especially cruciferous vegetables such as broccoli, cauliflower, Brussels sprouts, cabbage, and kale. These foods provide fiber and a wide variety of micronutrients and plant compounds. They can help you build meals that are filling without being excessively calorie-dense. And here's a useful strategy. Don't ask, what single food will clean my liver? Ask, what foods can I eat consistently that make my overall diet healthier? That's a much more powerful question. Remedy number 5. Protein and choline-rich foods. Choline is an essential nutrient involved in normal liver function and fat transport. Foods containing choline include eggs, fish, meat, soybeans, and some dairy products. Eggs can be part of a healthy diet for many people. Fish is another excellent choice, particularly fatty fish such as salmon, which provides omega-3 fatty acids. But don't think that eating one specific food will flush fat from your liver. Your diet works as a whole. A plate containing lean protein, vegetables, high-fiber carbohydrates, and healthy fats is generally much more useful than chasing individual superfoods. The role of weight loss. If someone with overweight or obesity has fatty liver, gradual weight loss can be one of the most effective lifestyle interventions. Even modest weight loss can improve liver fat. Greater sustained weight loss may produce larger improvements in liver inflammation and fibrosis risk. But this is important. You do not need to starve yourself. Extreme diets can be difficult to maintain. The goal is sustainable progress. Think about losing weight gradually while improving your food quality, physical activity, sleep, and metabolic health. That's a much more realistic long-term strategy. What about intermittent fasting? Intermittent fasting has become extremely popular. You may have heard about the 16-8 method. That means eating within an 8-hour window and fasting for approximately 16 hours. Some people find this useful because it helps them reduce snacking and overall calorie intake. But intermittent fasting isn't magic. The main benefit may come from helping some people eat fewer calories and maintain a healthier eating pattern. If fasting helps you eat better and you feel well doing it, it may be a useful tool, but it isn't appropriate for everyone. People who are pregnant, have certain medical conditions, have a history of eating disorders, or take medications that can cause low blood sugar should discuss fasting with a healthcare professional before trying it. And you don't need a 16-hour fast to improve your liver health. A consistent, balanced eating pattern is more important than a specific fasting number. What about seed oils? This is another topic that creates a lot of confusion online. You've probably heard that canola oil, soybean oil, corn oil, or sunflower oil automatically cause inflammation and fatty liver. The evidence isn't that simple. Seed oils are not automatically toxic. The bigger concern is often the overall dietary pattern in which they appear. For example, ultra-processed foods may contain refined oils alongside refined carbohydrates, added sugars, excess sodium, and large amounts of calories. Instead of becoming terrified of one ingredient, focus on eating more whole and minimally processed foods. Extra virgin olive oil can be an excellent choice. Nuts and seeds can be excellent choices. Avocados can be excellent choices. Fish can be excellent. And the goal is to build a balanced diet rather than create a long list of forbidden ingredients. The exercise that your liver needs. Now here's something that doesn't require buying a supplement. Walking. Regular physical activity can improve metabolic health even when the scale doesn't change dramatically. You don't need to become a professional athlete. Start with 20 to 30 minutes of brisk walking. If you're currently inactive, begin with a shorter period and gradually increase. Over time, aim for regular aerobic activity combined with resistance training. Strength training is particularly useful because maintaining muscle mass helps support glucose metabolism and overall metabolic health. So don't only focus on cardio, build muscle, walk regularly, reduce long periods of sitting, and find activities you can actually maintain. Sleep matters too. Here's something many people overlook: sleep. Poor sleep can affect appetite, insulin sensitivity, energy levels, and weight management. If you're sleeping 5 hours every night and then trying to fix your metabolic health with supplements, you're missing an important piece of the puzzle. Most adults should generally aim for around 7 to 9 hours of quality sleep. Try keeping a consistent bedtime. Reduce unnecessary screen time before bed. Keep your bedroom comfortable and dark. And if you regularly snore loudly, wake up gasping, or feel exhausted despite getting enough time in bed, talk with your doctor about possible sleep apnea. Improving sleep can make healthy eating and exercise much easier. The 7-day liver health reset. Now let's put everything together. Here's a simple 7-day starting plan. Day 1. Remove sugary beverages from your routine. Drink water or unsweetened beverages instead. Day 2. Take a 20 to 30 minute walk. Don't worry about speed, just get moving. Day 3. Build your meals around protein and vegetables. For example, eggs and vegetables at breakfast, chicken or fish with a large salad at lunch, and lean protein with vegetables at dinner. Day 4. Replace highly processed snacks with whole food options. Think fruit, plain yogurt, nuts, vegetables, or another nutritious option that works for you. Day 5. Add a source of healthy fat. Extra virgin olive oil, avocado, nuts, seeds, or fatty fish can all fit into a balanced eating pattern. Day 6. Focus on sleep. Choose a consistent bedtime and aim for adequate sleep. And Day 7. Review your habits. Don't ask whether your liver has magically been detoxed in 7 days. Instead ask, did I drink fewer sugary beverages? Did I move more? Did I eat more vegetables? Did I reduce ultra-processed foods? Did I sleep better? If the answer is yes, you've already started moving in the right direction. What you should not do. Now let's talk about some mistakes. Don't buy a dozen liver detox supplements and assume they're going to undo years of unhealthy habits. Don't take high-dose supplements without understanding their risks. Don't stop prescription medication because somebody online told you that your liver needs a detox. Don't attempt extreme fasting without medical guidance if you have a condition or take medication that makes fasting risky. And don't ignore abnormal blood tests. Your liver is too important to gamble with. When should you see a doctor? If you have been told that your liver enzymes are elevated, if imaging has shown fatty liver, or if you have diabetes, obesity, high triglycerides, or other metabolic risk factors, talk with your healthcare provider. Your doctor may recommend blood tests, ultrasound, or other assessments depending on your situation. One important goal is determining whether there is significant liver fibrosis or scarring. Fat accumulation itself isn't the only issue. The progression toward inflammation and fibrosis is what makes advanced liver disease particularly concerning. The good news is that lifestyle changes can make a meaningful difference for many people, and the earlier you address the problem, the better. The big picture. Let's bring everything together. There is no single tea that melts liver fat overnight. There is no vinegar shot that magically detoxifies your liver. There is no supplement that replaces a healthy diet. And there is no 7-day miracle cure. But there are things you can do. Eat more whole foods, reduce sugary beverages, limit highly processed foods, eat plenty of vegetables and fiber-rich foods, choose appropriate sources of protein, stay physically active, build muscle, get enough sleep, maintain a healthy weight when possible, and work with your healthcare provider if you have risk factors or abnormal test results. Your liver doesn't need a miracle. It needs consistent support. And the best part is that you don't have to change everything tomorrow morning. Start with one habit, then add another. Replace one sugary drink. Take one walk. Cook one healthier meal. Go to bed 30 minutes earlier. Small changes repeated consistently can become powerful over time. If you've been worried about fatty liver, don't panic. And don't assume that feeling tired automatically means your liver is damaged. Instead, use that concern as motivation to learn more about your health. If you have risk factors, get appropriate medical testing. If you've already been diagnosed with fatty liver, don't give up. The condition is often closely connected with metabolic health, which means that improving your overall lifestyle can be an important part of managing it. And remember, your liver is remarkably resilient. But it deserves more than a detox drink once a month. It deserves daily habits that support your entire body. So start today. Drink water instead of a sugary beverage. Take a walk. Eat a meal built around whole foods. Get enough sleep tonight. And if you've been putting off a medical checkup, make that appointment. Your future health is worth it. Medical disclaimer. This video is for educational and informational purposes only. It is not intended to diagnose, treat, cure, or prevent any disease. If you have symptoms, abnormal liver tests, fatty liver disease, diabetes, or take medications, speak with your doctor or another qualified healthcare professional before making significant dietary, fasting, exercise, or supplement changes.